What initially had me go to a doctor was just back spasms. I'd always had kind of a dulling pain, but there was one night where I was just kissing my daughters, going to bed and saying sweet dreams, and it wasn't in a turn or it wasn't in anything. I just started walking away and something happened and I dropped to the floor and could not get up. So after that, I started, like I said, started with x-rays, then an MRI, and talking to a neurosurgeon and then Dr. Tony. But basically it was just spasms that led me to coming to the doctor.
In Michael's initial evaluation of his spine on x-ray was one that you saw a lot of damage. The spine has been out of alignment for a long period of time with the lumbar kyphosis that caused a rapid deterioration of the discs and the bones, the bone going through bone degeneration, the disc was going through disc degeneration, which led to herniated disc, degenerated disc. His lumbar spine was looking at a much older age than he actually was. It was aging faster than him because of the alignment.
So the back pain impacted my family life, kind of kept me from doing things. I coached my daughter softball, but I wasn't as active as I wanted to be. One of my other twin, Peyton, started to get into basketball, and so I could go around and shoot around with her, but anytime I'd take a jump shot, it was basically like riding in a car without shocks. I would land and I would feel like a stun up to my chin and jaw. And said even going out to dinner with the wife, standing in a bar area, after 2 minutes, it just becomes uncomfortable to where I feel like I have to squat and kind of stretch my back out. So all in all, it impacted my family life by kind of pulling me away from a lot of different events one way or another.
So what Michael was developing was something called the degenerative scoliosis. It was happening as a response to the degeneration that was occurring in his spine from all the disc issues and all the bone alignment issues. Left uncorrected, his spine was going to degenerate to the point where it fuses together, either at some point where he would need some super invasive surgery or be disabled as a result of it. So correction in his spine was something that had to happen if he wanted to live a fulfilling life.
So my treatment has been very intense but tolerable. Like I said, it's basically starting off with a series of warm-up exercises, then going on to different tables to try to loosen me up and reshape the lower part of my spine.
When we speak about a lumbar lordosis, we know it should have a positive curvature, a forward bending curvature of roughly between 40 to 45 degrees on average. Well, with Michael's x-ray, he was bending negative. He was actually bending backwards. It was a negative 13-degree curve. So his curve, his spine was literally almost 60 degrees out of alignment in the lumbar spine. 60 degrees is considered a severe scoliosis where they put a rod up and down your spine almost immediately. So that's how severe his spine was. So through the intensive care and the therapy that we were doing in the clinic, we were able to take that negative curvature and make it positive, actually bend it the right way, actually moved in the right way, and now it's a positive 22 degrees. So he had a 30-degree swing. 30-degree swing in the right direction. So of course he's going to have a dramatic improvement in the way he was feeling, the way he's functioning, because you have that kind of change, you're taking pressure off the nerves, the discs are getting better, everything's getting better. Now we just have to hold it that way so his body can continue to heal and continue to repair itself over time, which I know it will as long as we can hold it in that right place.
As far as like day-to-day life, last night I was coaching my daughter softball and we were shagging balls in the outfield, and I had one to where it wasn't a movement that I would have been able to do before, where I had to track a ball down and literally stop what I was doing, turn my entire body and sprint while watching the ball go over my head and still, catch it, which, a move that was done when I was 18 and not since then. The results themselves have been noticed but hard to explain, but I just kind of see them after the fact, like, well, I wouldn't have done that a week ago, so. They've definitely been noticeable on paper and in real life.